In the last video, I promised you another video that discussed specifically cannabidiol, or CBD, and Cytochrome P450. So here it is. I'm your host, Dr. Elise Snipes. Cytochrome P450 enzymes are things that you have in your body which are responsible for breaking down many substances so your liver can clear them out of the body. CBD is one of the most potent cytochrome P450 inhibitors. What does that mean? That means it keeps cytochrome P450 from doing its job with a lot of different medications, and it can increase blood levels of those drugs that you're taking, including antidepressants and opioids and benzodiazepines, for example. People taking other drugs that are metabolized by cytochrome P450 should seek medical supervision and potential dose adjustments prior to taking CBD. This, in certain cases, can be life-threatening, so it is important not to assume or take for granted that something that you can get over the counter like CBD is safe to take with other medications. The medications that are metabolized by cytochrome P450 often come with a grapefruit warning. So that's the easiest way to identify what might interact with CBD. But here is a list of them, just to give you an idea. Antibiotics, antimicrobials, anti-cancer medications, so chemotherapy, antihistamines, like Benadryl and Zyrtec and those sorts of things, anti-epileptic drugs, blood pressure medications, blood thinners like warfarin, cholesterol medications, those are called statins, corticosteroids like prednisone, NSAIDs like naproxen, ibuprofen, so those over-the-counter medications, erectile dysfunction medications, proton pump inhibitors like they're acid reducers. Zantec's not on the shelves anymore, but like Zantac. Heart rhythm medications, immunosuppressants like one would take if they've had a organ transplant. Psychotropic medications, like I mentioned earlier, what we're talking about is your antidepressants, your anti-anxiety medications, pain medications, including opioids, and prostate medications. So you can see that cytochrome P450 is a really important enzyme at breaking down certain medications and clearing them out of your system. And when people use CBD, it keeps cytochrome P450 from doing its job. So some of these can really build up to toxic levels. In other instances, it may work the opposite, where the medication keeps the CBD from doing what it needs to do. And you can look in the notes on this video, and there will be a link to this article that is on PubMed that has a table. It's a real nice little table that identifies for you which medications are increased by CBD and which medications tend to decrease the availability of the CBD, just so you're aware and you can make educated decisions. Thank you for tuning in, and I'll see you in the next video on cannabinoids in mood disorders and the impact of CBD.